There, everyone. Amanda Mehl here with the Boone County Health Department. I am so excited this afternoon because I am joined with Dr. Phoenix, our medical director and a local provider here in Boone County. And we are very excited to offer a virtual fireside chat with the members of our Boone County community to talk with all of you a little bit more about the COVID-19 vaccine, ease your mind, address some of your concerns, answer many of your questions, and hopefully get the opportunity to speak with one of our local medical experts here who can answer a lot of what we want to know about the COVID-19 vaccine. Dr. Phoenix, thanks so much for joining us. How are you feeling this afternoon?
Very well, thank you, and a good opportunity to help the people and residents of Boone County understand our excited situation about finally going after COVID-19.
That's great, Doctor. Thanks so much. So I think we'll just jump right into our fireside chat. Boy, I wish I was actually sitting in those chairs by the fire, but unfortunately, it's not safe to do that yet until everybody's been vaccinated. So for now, we'll just have to live with the virtual option. So Dr. Phoenix, so many people want to know, is this vaccine safe and is it effective? Can you tell us more about that? These COVID-19 vaccines, are they safe and effective for us?
Yes, we do have available now 2 vaccines, Moderna and Pfizer. They're 95 to 96% effective after your second dose. Very minimal side effects. Almost everyone qualifies for it. And an effective rate at 95 to 96% is a very high effective rate. Our flu shots don't even come close to that on a yearly basis. I would highly encourage, when it is your time in this community, and you are available, and we say it's available to you, that you take it, your family that's able to take it, because we have to put an end to this COVID-19 that's been a scourge of our community and our society.
Great. Thank you so much, Doctor. I know you have done a lot of reading and research about these famous clinical trials that were happening in the spring and summer months while we were battling the pandemic. Can you tell us a little bit about what Moderna and Pfizer found when they were conducting those clinical trials so people can understand how important clinical trials are for the vaccine development process?
And there's 3 phases to vaccine developments. Phase 3 was the last one that everybody had heard about. There was 40 to 50,000 people per manufacturer. It was found to be safe and effective with rare complications. The one that everybody has heard about is the anaphylactoid reaction. It is not due to the vaccine. It is not due to a virus. There is no virus in this vaccine. It is due to a diluent called polyethylene glycol. Polyethylene glycol is really rare reactions in the general population. The risk of getting a polyethylene glycol reaction, getting your shot during that day, is less than the drive and the risk in your car to get your vaccine, and the risk of a car accident or something of that nature.
Great, thank you so much. That really helps to clarify. So can you help us understand too, like what is in this vaccine? What are the contents of the COVID-19 vaccine?
What these 2 companies did is they found the little spikes of the pictures you've seen on TV of what the coronavirus looks like, and have found a protein sitting there, and they've been able to produce something called messenger RNA synthetic. And when you inject that into the person, your immune system actually makes an antibody against that protein. When that protein is attacked, especially since it's on the virus will die and not be able to infect you.
Got it. Great. That makes a lot of sense. So I know a lot of people call and they have questions like, for example, if I'm pregnant, can I get the vaccine? Or if I'm breastfeeding, can I get the vaccine?
Up until just a few days ago, because they did not study pregnant women in breastfeeding. However, a couple days ago, it was released by some of the societies of gynecology and obstetrics that it is a patient's choice. They should be offered the option of the vaccine. Unfortunately, women who are pregnant and have delivered, some have had poor outcomes because of this, and that's why there's been a slight change. So right now, if you probably should talk to your OBGYN and see what their recommendation is. But right now, if you come to a clinic that you're in one of the risk categories, we will vaccinate you if you wish to be vaccinated. And when I say the risk category, I'm talking about these 1A, 1B stratifications we're doing with the new release of the vaccines.
Awesome. Doctor, thank you so much. Can my child get the vaccine?
There are two age groups that you limit out on. Pfizer will go down to age 16. Moderna will only go to 18. That has not been tested. There is no clinical trials. They are in the middle of doing their clinical trials, but as of right now, it is not allowed for under 16 in Pfizer and 18 under Moderna's vaccine.
Okay, thank you so much. What if I have certain allergies or underlying medical conditions? Are there any reasons why I shouldn't be getting the vaccine at this time?
If you're in the category to be able to get a vaccine, there are very few limitations, and the only major limitation are those who have had a major vaccine reaction with an anaphylactoid reaction, and that is extremely rare for this vaccine situation.
Great. So a lot of people are very nervous about the side effects that they're hearing about on TV and in the news and through word of mouth. What are the most common side effects of these COVID-19 vaccines that I should be watching for if I get vaccinated?
The most common side effect is you don't have any side effects. After that, a sore arm, maybe a headache, maybe a low-grade temp, occasionally chills, all occurring within the first 24 hours. After that period of time, it tends to disappear. But once again, most people are not having any side effects.
Great, thank you. So another question we hear a lot is, if I'm receiving the vaccine, is COVID-19 being injected into my body?
Absolutely not. This has no component related to the virus or anything thereof, so there is no way to get COVID-19 from this vaccine.
Okay. So after getting the flu shot, I always get the flu. Will the COVID-19 vaccine cause me to get COVID-19?
Absolutely not.
Okay. What if I need to get a flu shot and a COVID-19 shot? Can I get them at the same time, or do I have to wait? Or what if I've just recently had another vaccine? Should I be concerned?
We're trying to separate that by a little bit, by I believe it's 14 days.
So a lot of people are asking if they have already had COVID-19 and they've recovered, should they get the vaccine? Should they be vaccinated?
Yes, the recommendation is all people, whether they've had COVID or not, when their time is available, should be getting the vaccine.
Okay, thank you so much, Doctor. What about somebody who gets their first dose of the vaccine and then they get exposed to and they contract COVID-19? Are they able to get that second dose, or do they have to wait, or what can you address their concerns about that?
In all likelihood, they will be able to get the second vaccine because they'll be outside of that time reference. But if in doubt, it could be spread out by a few more days, but they should get their second vaccine.
Okay. And so all the vaccines right now, Doctor, that are available they're all two dose series? Do I have to get 2 shots, or are there other options available to me?
Yes, here in this country, by the FDA recommendations, they all at this time are 2 dose. Coming down the road will be Johnson & Johnson's vaccine and sometime in February, and that may be a 1 dose shot. But they have not met all the criteria by the FDA to be released, so they are not absolutely sure as of yet.
Okay. I keep hearing that a lot of people have more side effects after the second shot. Is that true?
That may be true. However, we have not had many people getting the second dose shot because we're still in that first early phase. That will be determined better as we go along on that second phase. However, it is far less on the side effects than getting the COVID disease and the consequences of that by far.
Great. So once I'm vaccinated, then do I have immunity to COVID-19?
After your second shot and 10 to 14 days after the second shot, based on the FDA statements, you have a 95 to 96% immunity. You still have a 4%. We do not know if you can become infected and spread it, even though you do not become sick. A very important point is those who have had their second shot, the serious illness of hospitalization, ventilator, and unfortunately death does not seem to be occurring.
Okay, great. So I have another question too that I've been hearing a lot of people asking about. People are wondering about the precautions that they have to take after they get the vaccine. So once you're vaccinated, do you still have to wear a mask? How long will we be wearing masks once we start to be vaccinated?
You still need to do all the appropriate defensive situations with wearing a mask, social distancing, washing your hands, etc. Because that's still a defensive maneuver until we get enough people immunized that the virus itself is disappearing from our community. The vaccine is the great part is it's our first opportunity to go on the offense against this virus, to finally kill it off and get rid of it from our community and get back to a normal society. Schools open, restaurants open, but we need everybody to get the vaccine. But until we have a high enough number of people vaccinated, we still have to continue with our defensive maneuvers because it is our only other option till that point.
Do I have a choice as to which brand I get? Is there one brand that's better than another brand right now that's available?
The two FDA approved vaccines are the same effectiveness, and usually it will depend on which local health department or hospital that you would be receiving it from, which vaccine they are actually shipped from the state or the federal government.
Dr. Phoenix, a lot of people are wanting to know more about what is herd immunity? What does it mean? How do we achieve it? And why is that a benefit to society?
Herd immunity was originally used in vaccinations and not used based on other societal things that people have discussed. Herd immunity means when you get sufficient amount of vaccine into a population, the virus cannot spread further. As explained by Dr. Fauci and others, we need to get anywhere between 70 to 85% herd immunity, where that means is 75 to 85% of the population will be having antibodies to the virus and unable to spread it further.
Okay, great. Is this a vaccine, doctor? I know there's still a lot we don't know about COVID-19 and the long-term vaccination efforts that we'll be faced with, but is this a vaccine that people are gonna have to get more than once? Do you think we'll have to get it every year? Do you think they'll need a booster shot later down the road? A lot of people wanna know what's in store for us in the coming years with COVID-19 vaccines.
That is still an undetermined answer, partly because we have not had the vaccine long enough. Some of the recent stuff says 1 year, 2 years possible, but we will not know that till we have a sufficient population vaccinated and we can actually measure the antibody response. There is some evidence also that it may be a lifetime vaccine. But once again, that information is not available at this time.
Okay. So when we get vaccines, the idea is that it allows our body to begin to build up some protection or immunity to a particular disease, right? So how does that work inside the body? Like I get a vaccine, how is my body working to develop protection?
Yeah, in our body, we have lymphocytes and other cells that actually find a foreign piece of material, whether it's a bacteria, a virus, etc., and they develop something called T cell antibodies and immunity. The T cells then in the future, if you're exposed to something, are mobilized and they attack the virus or bacteria before it can enter the body and cause significant harm. That's what the immunity of a vaccine does.
Okay. And I know before COVID-19, we had a lot of people that had concerns about vaccines in general, just as far as, the safety aspect, but also concerns that possibly, especially children, can contract autism or other major challenges with their bodies or their mental or physical health down the road because of a vaccine. Is that an issue with COVID-19 vaccines or other vaccines right now that we should be worried about?
The anti-vaccination movement, the scientific evidence is that is not true. It is a false situation. Vaccines do not cause autism. Vaccines do not cause other diseases. And you can feel safe at this point that this vaccine will follow the same as the other ones.
So I know a lot of people ask too, because they've heard in the news that the COVID-19 vaccine actually was beginning the process of being developed well before we were dealing with the current novel strain that we have right now. Like, there's been research happening for years before 2019 and 2020. Can you help us to understand how laboratories and science work on vaccines all the time when they're preparing for a novel strain that may occur like we're experiencing now?
The process that Pfizer and Moderna's vaccine has been developed has been in the process for at least a decade. The process is what is important, where they can identify that little key on a virus or a bacteria and be able to develop a vaccine fairly quick and safe. Interestingly enough, this process will become a major factor in our future vaccines for many different diseases because they're going to be able to create more based on this process. So this is not an untried process. Processes for old vaccines took years because you had to grow it on certain special medium and everything else. That is not the case with this process. This process is a process that's been in the works for 10 years and been tried and true in other situations.
Okay. So COVID-19 is a novel or new strain of a group of viruses that have been around for a really long time. Can you help our audience understand a little bit more about the family of viruses that COVID-19 has come from?
Yeah, COVID-19 is from a SARS virus. A SARS virus, there's multiple ones in the world. Some of the common colds are SAR viruses. This is a strain that appears to attack the human body and cause serious diseases. And it is a different virus. It's the same SARS virus, different type of SARS virus. That's why they call it a novel SARS-2.
Dr. Phoenix, would you recommend that all of your patients get the COVID vaccine? Like, how are you helping your patients to understand the importance of the vaccine?
There's very few people who should not take this vaccine. The sooner they take it, they become part of that part of our society that is to stop and help fight on the offense against this disease. As you, Amanda, know, and myself, you gave me my vaccine. I gave you your vaccine before we went on the front line. And yes, I have no reservations about recommending this.
So you, doctor, you want to let everybody know that you've had the vaccine and you're feeling fine, and you know others that have personally had it, and how are they doing?
I have not heard of anybody who's had any kind of major side effect. A couple people have talked about a sore arm, but from my own standpoint, I cannot really say I had any side effects after the vaccine.
Great. Dr. Phoenix, is there anything else that you want to share with our local Boone County community right now regarding the vaccine, so that we can help to push out information from medical experts such as yourself as to why this vaccine is so important right now?
It is, this is a more of a sort of a personal note. For 9 months to a year, we've been fighting this virus and truly on the defense. We've been having masks, we've been social distancing. Our society has dramatically changed. We've unfortunately lost hundreds of thousands of people, and millions have been ill with complications from this disease. This disease is a scourge. This is, if to use a basketball analogy, the only thing we've been able to do for this last year is play defense. We have never got a shot at shooting at the basket to win this game. As of the last few weeks getting this virus vaccine, we are now on the offense. And as we go through this offense, we still got to stay on the defense of wearing the mask, etc., till we can put this virus where it belongs and get rid of it from our society so we can get back to normal. We are not getting back to normal until this virus is gone. So we need the help of everybody in the community, family members, etc., to participate so we all can return to normal life, get our kids back in school, have a county fair this summer, have other various programs and gatherings that we have been short of for the last 9 months to a year.
Great, thank you so much, Dr. Phoenix. Any other words of wisdom for our Fireside Chat viewers today?
No, I'm just wondering if the interviewer has any addition that she would like to add.
Great, Doctor. No, it's been really great to talk with you a little bit more about the vaccine. I always learn something when I talk with you, and we've been able to get a lot of these questions answered for our community members. I would just say too, if there are people who are viewing our Fireside Chat today and they have additional questions, or they have some concerns, or they're on the fence about getting the vaccine, please talk with your primary care provider. But also you can contact the Boone County Health Department or your local health department in your county of residence. So we have a COVID-19 information line, which is 815-547-8561. And you can call anytime Monday through Friday, 8 to 4:30, or you can leave a message on nights and weekends, and we'll get back to you as soon as we can. We also have a email information line, which is COVID-19, all one word, at boonehealth.org. Again, that's COVID-19 at boonehealth.org. Please feel free to send your questions or concerns to us, and we will do our best to address them as quickly as possible. Dr. Phoenix, thank you so much for your time. I know it's a precious time right now because you are on the front lines fighting this pandemic. We want to thank you for all the work you're doing in providing essential services to the community. And we'll go ahead and conclude our Fireside Chat. It's been nice chatting by the fire with you today. Thank you.
I would like to add to that. I appreciate the comment, but we also have a highly dedicated team sitting at Boone County Health Department. And these people are doing their best to get this vaccine in everybody's arm as soon as possible, so that this community can do well. So thank you and the rest of the team at the health department for this situation too.
Great. Thank you, Doctor, very much.
Have a good day.
Thank you.